Morning, all. My name is Zaradin.
It is a pleasure to be here, to be amongst persons living with HIV that are putting a human face to a disease that has ravaged this world. But then the community has not been quiet. The community has been very active. It's 35 years, and we are still counting. Some people who started this fight are not here with us. But then the mantle has been handed over to us to continue the struggle. From UNAIDS, we are saying we want to see a world that there is no person dying of AIDS, that there's nobody being infected with HIV, and then nobody is discriminated upon. And so it is important that for us to get to the 3 zeros, we definitely need to keep activism on. The theme of reflecting on the past and projecting into the future definitely tells us that there were some good things that were done in the past that today is no longer there. We know the fight that the faith-based organizations made. I remember the Catholic Church was involved in this very actively. Now, it is not like it used to be. These were institutions that were serving with compassion. They were seeing people dying, and they started screaming. The community listened, government listened. People have mobilized that this is a reality. And going by the role play that we all saw, you see clearly that people have been empowered. People are talking about the good news that we want to see going into the future is 0 new infections, 0 AIDS-related deaths, and 0 discrimination. And for sure, we can only get here when everybody has access. Everybody who needs HIV services has access to HIV services. And so the take-home message that I'm taking from here basically is that the people of the community of persons living with HIV are saying user fees is a barrier to accessing services. And as I speak, I can confidently tell you that the Executive Director of UNAIDS, Michelle Sidibe, is working hard on making sure that user fees should not be a barrier to anybody living with HIV. In the World Health Assembly that is going to take place next week and beyond, he's meeting a lot of the ministers of health and putting on the table that what is the point in having drugs in our facilities that people cannot access because they cannot pay the user fees. And so advocacy from the UNAIDS that we cannot achieve our 1990 targets if user fees continues to be a barrier. Nigeria has the 2nd largest epidemic, and I'm very happy about what NEP1 has been doing, the type of leadership that is coming from NEP1, because they are keeping government and partners on their toes. That we, as people living with HIV, definitely need to have our voices heard. And for us, as UNAIDS, NEP1 is our biggest partner. In as much as we support what government does, ours also is to also support what NEP1 is saying. User fees is a barrier, and the policy people are listening to what you are saying. Partners are listening to what you are saying, and I hope that government would make a decision. Some countries have managed to go around the issue of user fees by making sure that national health insurance schemes work. If national health insurance schemes work, then people will no longer be bothered by issues of user fees. So if in this house, the loudest noise that we are hearing, the loudest message here is that user fees is a barrier to persons living with HIV, persons suffering from TB, and so those also having malaria, then definitely it is a policy issue that has to be taken on board. And I can see that is your message on this anniversary, and it is important that we all make our voices heard. We should engage our politicians to make it a topical issue so that this should not be a barrier. I am happy we are talking about stigma, but then from what I saw, stigma alone was not the issue. The issue is that drugs are available. Test kits are available for people to know their HIV status. And for those who test positive, they need to have access to these drugs. Whatever barrier that is between the patient and the drugs, we need to take it out. And the message I'm hearing from here is that user fees is that single barrier within the health systems that has to be taken out. And so as UNAIDS, ours is to advocate. And that is why I said that our executive director is working with ministers of health globally during the World Health Assembly. That is going to happen, that user fees should be addressed. In West and Central Africa, many of us, there are 6.5 million people living with HIV in West and Central Africa. The barrier is also about user fees. And so we all have to put our hands on deck and be able to address. We support NEP1 in all your fight towards making sure that this happens, so that we do not see people dying because they can't have access to services. Those who started the fight, it is now our time to make sure that we move and send people to the promised land. The promised land here is that no child should be born with HIV in Nigeria and in Africa and globally. And it takes the effort that you and I will put in. Nobody should die because you have HIV. Nobody should die because you have TB. And it is important that no child should die because that child has malaria. We need to take collective action as people. Those who started this candlelight did it at a time that there was no drugs. We have drugs. But then the issues of today is kind of different from the issues of yesterday. And so it is important that we table these very barriers that are preventing people from having access for them to be addressed. As partners, we will work with you to achieve that objective. Thank you very much.
Thank you. Which aims to be positive and forward-looking. Today, for the 35th time, NEP1 is joining organizations across the world to commemorate the International AIDS Candlelight Memorial. Communities, support groups of people living with HIV will raise awareness around HIV, and we all stand together with people living with HIV and to remember our friends, our family, our loved ones who are lost to HIV and AIDS. When the AIDS Candlelight Memorial was held in 1983, no one could have predicted the scale and the impact of the global HIV epidemic that is now well into its third decade, with millions of lives lost and close to 37 million people currently living with the virus. We as part of the global community will remain profoundly challenged by this epidemic. For some, HIV has become a manageable chronic disease, yet for far too many, HIV is still a deadly life or death struggle. For treatment and for care, adequate food, housing, and income, often in the face of pervasive HIV-related stigma, discrimination, and violence. The epidemic continues to shine a light on the injustice and exclusion in our societies, while opening space for continued solidarity and resistance by all of our beloved communities that have carried the weight of this epidemic, including the members of the LGBTI community, the sex workers, people who use drugs, women and girls, and adolescents and children. The International AIDS Candlelight Memorial reminds us of the tremendous impact that HIV and AIDS movement have had on our lives. The memorial emphasized the need for people living with and affected with HIV to join hands and reflect on the past and the precious lives that we have lost. The memorial also calls on us to share our stories of what the AIDS movement have achieved over the last 3 decades. Finally, the memorial asks us to work together, now more than ever, to sustain, strengthen, and revitalize our national response to HIV by looking forward and preparing for a future free of HIV-related stigma and discrimination, and with universal access to the full range of human rights, including quality prevention, treatment, care, and support services for all. These are our prayers. Test and start. More people on HIV treatment. HIV testing is the first and most important steps towards ending AIDS. Rate of HIV testing in Nigeria is still very low unless the testing bottleneck is overcome. The potential of so many promising strategies will not be realized. Additionally, placing only 1,050,000 persons living with HIV on antiretroviral therapy in a country where less than 50% of those people who need the services are on ART is totally unacceptable. Antiretroviral therapy for HIV positive people is prevention, and the combination benefits of improved health needs to be encouraged for everyone. In the drama that was presented, we saw how user fee become a barrier that can even hinder people from accessing tests. It can also hinder people from accessing treatment. We're calling on the government of Nigeria and everybody to join hands together so that we can be able to implement our test and start policy, and our catch-up plan in the country needs to be accelerated. People need to be enrolled on treatment without any forms of barriers. NEPOAN is advocating that all persons living with HIV who are accessing treatment should have access to adherence support services, either at facility and community level. PLHIV should have access to second and third line drugs if they fail their first line drugs. And this should be done in accordance with the National ART Care and Support Guidelines. We're also calling on our government to own up the HIV intervention in the country. We appreciate the efforts of the international donor communities on who have been supporting Nigerian government to provide for treatment, prevention, care, and support for the patient community living with either TB or HIV in the country. Nigerians living with HIV demand that our government should increase funding and budget provision for HIV and AIDS, tuberculosis, and malaria intervention, which are some of the major barriers or factors responsible for the country's high maternal and child death. Nigeria should respect a commitment to Abuja Declaration 2001, stating that the health budget will be up to 15% of the national budget. The lives, hopes of survivor, and treatment access is at the mercy of Global Fund and PEPFAR, who are already fatigued and reducing their investment in the country. We have proved to the world that Nigeria is the economic giant of Africa. The Nigerian government should be responsible enough to own up the response, invest in the health and survival of Nigerians, and match the dollars with the naira in our treatment sources. NEPOAN, on behalf of every healthcare consumers in Nigeria, we also want to use this opportunity to appeal to the leadership of the Joint Health Sector Union, JOSU, Assembly of Healthcare Professional Association, AMPA, and the Nigerian Medical Association to reach a compromise and dialogue even with the federal government of Nigeria in a win-win approach to end this insensitive strike action within the health sector in Nigeria. NEPOAN also urged the federal government to implement the recommendations of the Yahya Ahmed Committee on Professional Harmony in the health sector. Nigerian Medical Association cannot work without the members of the Joint Health Sector Union, and they cannot work, the JSU members cannot work or do consultation without the members of the Nigerian Medical Association. Please do not increase the burden of HIV or the burden of health disease in Nigeria with the strike actions, as many of our members are denied access to their life-saving therapy and basic care due to these agitations. Finally, we are also calling First, we appreciate the effort of the Nigerian government and that of Mr. President to reduce unemployment and poverty in the country, but we are aware that women are carrying the higher burden of HIV without adequate family support due to stigma and discrimination. We hereby appeal to the Nigerian government to create equal job opportunities for persons living with HIV and AIDS, to integrate us into your skill employment programs and recruit persons living with HIV and AIDS to provide services in places where they have the capacity to. NEPOAN believes that Nigeria is African economic giant. Nigerian government should be responsible, and we can do it to take care of the poor, because people living with HIV are becoming extremely poorer. Government at all levels should invest in the community of persons living with HIV as a strategy to ending AIDS. Support us so we can be able to empower ourselves and provide support to our orphans and vulnerable children in Nigeria. Thank you.
Fight it, we shall fight it in UNITY. We shall fight it. Now we're going to peace.
Yeah, at this juncture, if my Reverend Sister, so please, Sister Veronica, lead us in the prayer.
We